a 62-year-old male who you tell us what he's not eating, but he has a parotid, is that swollen parotid?
Well, there's a little bit more history there than that. He has chronic Hep C,
Mm.
and I'm getting an echo, so bear with me here while I figure this out.
Oh,
He has chronic Hep C, and that's his primary issue. He every so often gets this problem in his parotid gland, which is clearly related to the Hep C. That's something that can happen, but it I think it's when he starts detoxing, it comes out in the parotid gland. But he, no matter what, I think, even though he listens to me most of the time, he's a very high-powered executive, and he insists on taking antibiotics whenever that happens. So this is now the fourth time that it's happened, and it really doesn't swell anymore. It's becoming, I think, more chronic and more kind of a degenerative state. But
but
we did a, go ahead.
so do you think it's going towards neoplasm?
Well, I can't really say that I know that either way. I'm just concerned about him insisting on suppressing that because that's not how I would ideally treat it. And no matter what I tell him, he's going to do what he's going to do. Even though the last time we treated it successfully without him doing the antibiotics, but he may have taken them and not told me. But it happened again, and now he insisted on taking the antibiotics, even though
Yeah.
he is taking a drainage protocol at the same time.
And the parotid decreases in size and swelling after his antibiotics?
Yes.
Okay.
So So again, the primary thing with him is that he has Hep C, and when we did a FibroSure test about 4 or 5 months ago, he did finally stop drinking all forms of alcohol. He had stopped hard alcohol and but was continuing to drink wine. And then after we did that and saw that he was kind of in between inflammation and some amount of fibrosis in his liver, according to that test. He finally stopped drinking all
Have you had
alcohol.
a, did you quantize the Hep C? Did you get a
Did
quant on his active virus? Does he have active virus?
He does have active virus. It's not as high as it's been in the past, but as far as what I understand about Hep C, that's not something that necessarily reflects what's going on with the liver function. So, but he definitely has an active
Well,
virus.
well, the liver is always trying to compensate, and it does it quite well up until the end. So uh, I usually quantize the, look at the viral actual activity, because some people who show a positive Hep C antibody are negative on the on active virus. So he does have this, and he has some. He's probably a rock star or something if he's high end and he has all this going. So I know how hard some of these guys are to treat. I've
Yes.
seen some of them.
Yeah, he's
Um,
a multimillionaire.
so
He does what he wants.
yeah. Um, so oh, sorry about
There's
that. So yes,
one
go
other
ahead.
thing I would say about him is that he has this issue of chronic frequent urination that is more under control now that he's stopped drinking caffeine. That's
Yeah.
kind of the primary thing, but he still can't sleep longer than 4 hours at a stretch, and he has to get up and then, but during the day, if he's drinking liquids, he has to pee every 30 to 60 minutes, and he hates this. He doesn't like to be inconvenienced, of course.
Have you done a PSA?
Yes, and it isn't, I couldn't tell you what that exact number is off the top of my head, but he's had all kinds of workups. I could look it up here, but take me a second.
I would say he should have an analysis of prostate by prostate ultrasound. But although his prostate here looks okay, So it could be just from the diuresis from coffee that he has a hyperactive response. But it's pretty normal if you drink a lot of coffee that you're going to pee more. And
But
then
he's not
add
drinking at all.
alcohol.
It's still happening.
Yeah, but it's coffee or alcohol. They're both diuretics.
But he's not drinking either one. He hasn't had alcohol for months and it was
Oh,
still happening.
he stopped coffee?
Yes, he stopped coffee and alcohol completely.
Well, I want I want everybody to look at this thermogram and tell me what is the biggest alert here. And it's because it's a very good thermogram for showing a hepatitis C patient who has something going very much wrong with how he's assimilating nutrition.
Well, certainly looks like he has food sensitivities.
Yeah, but what do you see wrong in the upper abdomen?
The liver, the stomach are blocked, the pancreas is blocked,
And this
the liver
pancreas
and
is
gallbladder are
also,
deficient, almost blocked.
and when we talk about hot or cold, then we're talking about the first measurement. And this first measurement of the pancreas is 3 degrees colder than it should be. And the coldness means, number one, an old condition, but number two, with the pancreas, means that his ability to produce enzymes of the pancreas is 0. So not only is the pancreas not functioning in the exocrine way, but it's actually degenerative. And this would be if I could only use one medicine on him, I would start with enzyme therapy.
And it's degenerative because of the first.
Well, the first reading is so cold, it means that it's way under functioning. And then when you look at the second point, that's actually telling you how well it's able to compensate, and it still might have some ability to have a good physiology and reaction, but his is blocked. So he has, in regulation medicine, now I'm not saying if you open up his abdomen and look at his pancreas, it's going to look horrible, but it probably won't look normal. It'll probably have some fatty tissue in it as well as the liver. But this very cold thing that sits here and hangs out beyond everything else except for maybe an intestine point is very key in the case. So now I'm going to take you through the prerequisites. So the glabellas are perfect. This is a perfect thermogram, like the first one we saw. They're both glabellas are going up in the same direction and a little bit, or within 1.2. So it's an accurate thermogram. Then we look at the side differences. In the cubital fossa, with the right is paradox, but it's at the same level as the left, which is blocked. So there's some circulatory deficit, but there's no side difference. And then we look at the chest. These two heart points or lung there, one is blocked on the right, which can mean more of a lung problem than a heart problem because the heart is mostly on the left side. So they're both cold, because look at where the other one started out. So these heart points are both cold. So I would say maybe there's some kind of stress that's occurring to the lung. Does he have any bronchitis or any kind of respiratory disruption?
He gets somewhat frequent cold type of things. He just calls them colds, and he immediately starts in on some remedies that I gave him years ago without even consulting me. But he's convinced it's from his grandchildren.
That makes sense, right? So not really. So then we see the lymph area. We see a lot of this paradox, and paradox is in the lymph is not a bad thing. That means your body's trying to fight with an inflammatory response. It's much better than blocked regulation. So, we in natural medicine like to see inflammation to the right degree and extent, because then we know the body is active. But if these were all blocked, there's only 7.7% blocked in the lymph. So that's not bad. That's not where we're going to focus the attention. And you'll see that if we looked for blocked regulation next, I'm sorry, we didn't start with blocked regulation, but we will backtrack a little.
Mm-hmm.
And here we see in the chest 14%. In the upper abdomen, it's horrendous at 43% blocked regulation. This is where your problem is, and you already know that by a hepatitis C patient. But this one, it tells you, hey, don't forget about the pancreas, because that might be, the pancreas and the liver, especially with glucose metabolism, are absolutely interactive. And so wine, beer, all that stuff is, wine especially acts like sugar. I'm sure he has insulin resistance.
Yes.
This blocked regulation here, so there might be some heavy metal, but it's not going to come out as a totally severe. And so our block points are in the chest, in the upper abdomen like crazy, and then a little bit in the lower abdomen. And then we're kind of not too interested in the teeth being rigid, but we're interested again in the side differences. So here we see a side difference 33.6 to 34.3. So that's a 0.7 difference, and 35.1.2. So there's a side difference in the upper jaw. And so we're going to let the teeth look at that. So now we have blocked regulation. We have some side difference. Do we see side differences in the head? Well, here the ethmoids have a side difference. And what does that mean?
Virus.
So, okay, we have a good valid test. So you'll find in herpes, in shingles, in hepatitis C, in cytomegalovirus, in Epstein-Barr virus, the ethmoids will usually be asymmetrical like this. The other points are pretty normal in the head. They're really not too bad. The CP points are a little behave different, but they come to the same level. And the same with these mastoids, they're not too bad.
So why does it say investigate major source in the head?
Well, the lymph 5 and 6 and the supraclavicular fossa, when they're warmer than 7 and 8, so you see that these 5 and 6 are warmer, that points to heat coming from the head or neck or head or teeth region. So there's some kind of lack of lymph flow that's flowing back through the great lymph vessels. So but it should be just kind of noted and not regarded as gospel. Because here, obviously, your biggest problem is here in the upper abdomen. The span of temperatures is 30 to 36, so that means that he's probably curable, or at least put into remission. If he follows your directions, which he probably won't do all of, but he needs to see this upper abdomen. He needs to see this picture. And I don't know, maybe you showed it to him already.
I'm seeing him in the morning, so this is perfect.
Good. So look, here's what he's doing. Here's what his body is doing. And he may not have the values in his life to be willing to do what's necessary to this whole region of blocked regulation and even inflammation. So you can tell him that all of this, including the circulation to his arms, especially on the right, you can tell him the gut is being affected, and you can show him this right pancreas being blocked, which is cardinal for enzymes. He needs heavy-duty proteolytic enzymes with liver detox and antivirals, or the virus will multiply and he'll develop towards what happens with Hep C. I was in gastroenterology for 3.5 years, and we would always say, Hep C, ends up if it's untreated, and now we have great treatments for it. But a lot of these guys that are in high profile positions don't want to go through the therapies for it, but they're pretty successful with it. But if they don't, they can end up with liver cancer.
Do you have any suggestions of what kind of antiviral things you would use?
Well, I don't think I can teach you on that subject. I use olive
Sure.
leaf. I use elderberry. I use high dose vitamin D. I would give him 50,000 once a week and 20,000 a day. And vitamin A, I would give him very strong herbal like berberis and chelidonium. And I would give him sanum therapy, lat, and muke.
Mm-hmm.
Muke is long term, and um, then I would alkalize him because he keeps wanting these sugars that'll feed virus, and so I would try to treat him, even though through stuff he's probably not going to stop with. Uh,
Mm-hmm.
but these are um, the ways that I go about doing it. I always use sanum therapy because it does things that nothing else does. And
Mm-hmm.
then you see in these teeth, guess where the teeth are? Liver, liver. This is a speckled sick number 6 and number 7 kidney, bladder. That could relate to maybe he has something that's affecting his bladder size or spasm. Maybe he has a spasm of the neck of the bladder, or he has a spastic activity that's constantly done. But I think tooth number 6 may, if that has anything around it, like a root canal or a crown, I would pull that off, or I would do an X-ray course, and then to really be concerned with this speckled tooth in the upper right. You see if any others are related to the liver or towards pancreas. Well, there's spleen, which in Chinese medicine relates to pancreas. So I'd consider those in these back teeth, but nothing as strong as this speckled look. Then in the prostate itself, there's only 1 out of 9 criteria. So I don't think that the frequent urination has anything to do with this prostate. I would be more inclined towards the kidney and bladder. The detox capacity lack, he has to be helped on. The heavy metal, who knows, he may be having a lot of lead from the wine. I don't know. I might try something like zeolite to just slowly give that some chelation.
Something like
Um,
what?
Zeolite,
Zeolite.
the peripheral circulatory problem will clear up if you clear up the liver and pancreas. Um, of course, we have the virus there. We have a little bit of TMJ, but that's the least of our problems. And then we have possible dental foci. That's important, and the lymph to some extent. And then this cardiac may be the lung. So it's very difficult to tell the difference, but since we saw it pretty much being a bilateral ear block as opposed to only on the left side, then we're more inclined to look at the lung capacity, but he could have something going on with the heart. Now here we have these indications for the pancreas failure and the liver. And this is where you should concentrate all of your efforts and show this to him and say, look, would you let me just treat these systems, and then you can try to control what he's taking in, but that might be the hardest thing. So that's a pretty it's a pretty telltale hepatitis advancing case with emphasis on the pancreas, and then we might have discovered something crucial in the teeth. So here again, we want to amend this cardiac function to be also a lung possibility, but really here in these number 2 and 3, the insulin and enzyme, and the other things, but we have to add the liver because that came out mild, but it should be here. So sometimes you have to add 1 or 2 that you get. So that's really where we want to go.
So the main thing with his frequent urination, you think, could be related to the tooth, but nothing else that we see here?
Well, it could be that since he has no pancreatic enzymes, that the proteins that he's having in his diet are undigested and causing stress to the kidney. However, the kidney looks okay. So if we look back, well, very difficult to say because this uterus prostate can be reading from the bladder, but all of these are normal. So I would suspect the frequent urination is not because of something's wrong with the kidney or bladder from this thermogram. And I would work with the upper abdomen and see what happens with the frequency. You should see it diminish when you're facilitating and you're taking stress off the kidneys by metabolizing his proteins much better.